Spinal degeneration is mostly found in middle-aged patients and the elderly. Joint degeneration is natural. It can happen to anyone, you know. For some, if they've had a prior accident or overused it, they'll experience degeneration faster than other patients. Some people have spinal degeneration, seen on x-rays and such, but have no symptoms. There are many cases, but the most common symptoms are back or neck pain, depending on where the degeneration is most severe. Then there's muscle stiffness, but we're concerned about 20% of cases because some have a pinched nerve and they're in a lot of pain. And what we fear most is the symptom of weakness. If weakness starts, like being unable to lift an arm or having trouble walking, numbness, or being unable to lift a leg, or foot drop where the leg drags while walking, this is dangerous because if treatment is delayed, it might not return to 100%. But if you have it and see a doctor quickly, we might fix it and return things to normal. I'd say 80% of cases don't require surgery at all. Taking medication alone can cure it. And for some, we might consider injections. If medication doesn't lead to improvement, this is a fairly effective treatment method in cases where the compression isn't severe. But if there's neck pain without radiating to the arms or back pain without radiating to the legs, we mostly treat by educating the patient on behaviors to prevent it. And if it persists, we might refer them to a physical therapist. There are other ways, like exercises to strengthen the spinal muscles. When do we perform surgery? There are several indications for it, you see. My first one is whenever there's weakness in the arms or legs, surgery should be done promptly. Because if we operate early, the surgical outcome will be better, recovery is faster, and it can return to 100%. And there are other cases where we'd recommend surgery, like if pain persists despite treatment, even after taking medication, or injections help but the pain returns. If you need 2 or 3 repeated injections, surgery is better, because frequent injections might not be good either. And importantly, does it affect their daily life? They like playing badminton or golf, but pain from a pinched nerve or herniated disc prevents them from living normally. This group of people wants to recover quickly. It's about improving quality of life. Spinal degeneration isn't severe, but if you suffer enough to affect what you love, having these symptoms impacts us greatly. So for this group, it's recommended, because nowadays, surgery risks are very low compared to the past. Then I must say technology has come a long way now. Using small incisions results in minimal blood loss. The surgery is quick than before. It's finished in just 1 hour, so there are many benefits. Middle-aged people recover fast, go home sooner, and have less pain. For seniors, anesthesia is brief, incisions are small, and blood loss is minimal, making this surgery safe for older patients. The safest way is to see a doctor first, because sometimes there are certain symptoms known as red flags that we worry about. If you are feeling unsure or if the pain is affecting you, come see a doctor for a screening, including a medical history check and a physical examination to make absolutely sure there is no hidden danger.